Okay. I'm going to be talking about Huntington disease. Okay. Huntington disease is an autosomal dominant disorder, meaning that a person only needs one copy of the defective gene to develop the disorder. Symptoms can develop at any time, but they often first appear when people are in their 30s or 40s. And this disorder is caused by a mutation in the HTT gene, and this gene gives instructions for making a protein called huntingtin. The CAG segment in a normal HTT gene repeats about 10 to 35 times, but in people with Huntington disease, it may repeat from 36 to over 120 times. The HTT gene mutation that causes Huntington disease involves a DNA segment known as a CAG trinucleotide repeat, and it is repeated multiple times in a row. And Huntington disease is caused by a gain of function mutation. Okay, so the age of onset, as I said before, for Huntington's disease starts about in their 30s or 40s. And there are movement disorders that include both involuntary movement problems and impairments in voluntary movements. And these include involuntary jerking or riding movements, muscle problems such as rigidity or muscle contracture, slow or abnormal eye movements, impaired gait, posture, and balance, and difficulty with speech or swallowing. Okay. So the case study I chose was about a man named Carl, and at this time he was 27. He was married to Susan, and they had 2 children. And Carl had a sister named Jenny, and then she was sick for, they said, 7 years, and they didn't know the reason of why. She had, there was an increase in the shakiness of her movements and everything. Her speech was slumped, and she appeared to be very depressed. And there was no test for Huntington disease at the time, but the symptoms all pointed to Huntington disease with all the observation. And Jenny, later on, she was in a vegetable-like state in a nursing home, and she died at the age of 47. She did not receive any treatment because Huntington's disease can only be treated by managing the symptoms, but it can't be cured. Okay. So the background information, the molecular cause. So Huntington's disease is caused by a mutation in the HTT gene, as said before, and the gene gives instructions for making a protein called huntingtin. The exact function of this protein is unclear, but it appears to be important to nerve cells, the neurons in the brain. And the HTT gene mutation that causes Huntington's disease involves a DNA segment known as a CAG trinucleotide repeat, and the CAG segment in the normal HTT gene repeats about 10 to 35 times, and in people with Huntington disease, it may repeat from 36 to over 120 times. And people with 36 to 39 CAG repeats may or may not develop Huntington's disease, while people with 40 or more repeats almost always develop the disease. And it is a rare disease because Huntington's disease affects an estimated 3 to 7 per 100,000 people of European ancestry. And Huntington's disease is less common in some other populations, including people of Japanese, Chinese, and African descent. Okay. So, since Huntington's disease is autosomal dominant, there is a 50% chance that he or she will pass it on to their children, and one copy of the mutated gene is sufficient enough to cause the disorder. So therefore, a diagnosis of Huntington's disease is more likely to be quickly reached if there is a family history of the disease. There's also symptomatic testing. It's where a specialist can help identify the characteristic symptoms of Huntington's disease as part of a diagnosis. The exams measure any changes in motor function, neuropsychological assessments that look for cognitive changes, and psychiatric evaluations to assess any behavioral changes. Also, an MRI can be carried out to identify changes that Huntington's disease causes in the brain, but also to rule out other conditions that may affect the brain. There's also genetic testing. It involves taking a blood sample from the individual and sent to a specialized center for examination. The test can determine the size of the HTT gene or how many CAG repeats are present. However, a diagnosis can be difficult if there are between 36 to 40 CAG repeats, as the disease may or may not develop in the person. There are movement disorders in the person that has Huntington's disease, and these are the involuntary jerking or riding movements, the muscle problems such as rigidity or muscle contracture. There's a slower abnormal eye movement. There's impaired gait posture and balance. There's also difficulty with speech or swallowing. There's also cognitive disorder where there's difficulty organizing, prioritizing, or focusing on tasks. There's also lack of flexibility or the tendency to get stuck on a thought, behavior, or action. There's also lack of impulse control that can result in outbursts, acting without thinking, and sexual promiscuity. There's also lack of awareness of one's own behaviors and abilities. There's slowness in processing thoughts or finding words. There's also difficulty in learning new information. There's also psychiatric disorders, which is the feeling of irritability, sadness, or apathy. There's social withdrawal. There's insomnia, fatigue, and loss of energy, and frequent thoughts of death, of dying, or wanting to commit suicide. And the treatment, there's no treatments that can alter the course of Huntington disease, but there are medications that can lessen the symptoms, some of the symptoms of movement and psychiatric disorders. There's medications for movement disorders. These are the drugs to control movement, which include tetrabenazine and deutetrabenazine. There's also antipsychotic drugs, which include haloperidol and fluphenazine. However, those drugs may worsen involuntary contractions, restlessness, and drowsiness. The antidepressants include citalopram and escitalopram, fluoxetine, and sertraline. And for the antipsychotic drugs, it includes quetiapine, risperidone, and olanzapine. So there are also mood stabilizing drugs that help prevent the highs and lows associated with bipolar disorder. These include anticonvulsants such as divalproex, carbamazepine, and lamotrigine. There are also other ways to manage Huntington disease, which include psychotherapy, where there is provided the talk therapy to help with behavioral problems. They develop coping strategies, they manage expectations during progress of the disease, and facilitate effective communication among family members. There's also speech therapy because, as said before, there is difficulty in speech and swallowing. So speech therapy controls muscles of the mouth and throat, which helps them with that problem. There's also physical therapy where they teach appropriate and safe exercises that enhance strength, flexibility, balance, and coordination, which is something that they struggle with that disease. And there's also occupational therapy that is provided to people with Huntington disease, which assists an individual with Huntington's disease and their family with assistive devices that improves functional abilities. It doesn't always have to do with devices. They also help with like coordination of movements and with hand movements as well, hand coordination, movement coordination, all that. Okay, so the inheritance risk. The inheritance risk pattern for Huntington's disease is autosomal dominant. So this means that anyone who has a CAG repeat size of 40 or more has a 50% chance of passing the risk of developing Huntington's disease onto their children. So, for example, if a man has a CAG repeat size in the intermediate range, let's say, for example, 35, his children could have a CAG repeat size of 40 and develop Huntington's disease, even though the man will not develop the disease. So couples will need to make additional choices about whether to have children or to consider alternatives, such as prenatal testing for the gene or in vitro fertilization with donor sperm or eggs. There's another option for couples in vitro fertilization and pre-implantation genetic diagnosis. In this process, eggs are removed from the ovaries and fertilized with the father's sperm in a laboratory. The embryos are tested for presence of the Huntington gene, and only those testing negative for the Huntington gene are implanted into the mother's uterus. That's crazy. So yeah, that was my presentation.